Hi folks, Dr. Jeffrey Roth here, your board certified plastic surgeon in Las Vegas, Nevada, and I want to talk to you a little bit today about breast reduction. We actually get a lot of this in Las Vegas, girls who are triple Ds or E's, whatever the case may be, and they have neck pain and back pain, etc. Sometimes we get referrals from orthopedic spine surgeons or neurosurgical spine surgeons. They say, well, you don't need spine surgery, you just need to go ahead and get this stuff here handled. And what I've seen time and time again is it's not just the mass, but it's also the pendulousness, the droopiness. And if you can control the pendulousness, oftentimes people will go ahead and feel better. It's kind of like if you have a backpack and the straps are too long and you put the straps back where they're supposed to be and things are sitting where they're supposed to, that I think really tends to help. These folks tend to be some of our most happy patients. Some of them say, gosh, I even feel better in the recovery room, which is not really normal for surgery, but we found this to be a very powerful operation. Okay, so how do we do all this and still make it look good, right? So here is basically our incisions for a breast lift. Now with a breast reduction, you also get the opportunity to lift things up. The other interesting thing with breast reductions is oftentimes folks will have large areolas, and again we have that opportunity to make the areola smaller as we move things up. I've only had 2 patients in 22 years saying, no, I like the areola size just the way it is. So again, one thing that we can do. Now, so how do we do it? Basically, you go ahead and you make your pattern as if you're going to go ahead and do a breast lift. Now, again, we always have the nipple areola complex attached to the patient. We don't take it off and put it on the table and staple it back on later, right? It's always attached to you. Okay, so the whole idea of the breast reduction is you want to make sure that the nipple areola complex has enough blood supply and nerve supply, right? Okay, so what you do is you go ahead and you make an island of tissue or a pedicle of tissue around the nipple areola complex, right? And depending on who you read, that should be 8 centimeters, 10 centimeters, et cetera, et cetera. Okay, we argue about that stuff at the big plastic surgery meetings. Okay, so, but the whole idea here is you've made an island of tissue around the nipple areola complex to give a blood supply and nerve supply. Okay, so you've already made your drawing, and your drawing again looks like a keyhole, okay? So you have the keyhole here, and you have your little island of tissue. The island of tissue stays. Everything inside this keyhole, medially, laterally, and superiorly, all leaves, okay? Now this is called an inferior based pedicle flap, and there's different types, and again we can have lectures all about that. But the bottom line is you have this island of tissue that's going to nourish the nipple areola complex, okay? You now take that island and you go ahead and you move it up into this area that you created by taking the tissue away. So this moves up there, okay? A goes to A, B goes to B, you fold it all together, kind of like origami, and it winds up looking like an anchor. Okay, so again, the reduction comes medially, laterally, superiorly, but you keep a certain amount of tissue, which is also important because people ask all the time, hey, how small can I get? And if you're an F and you want to be an A, well, that's a whole different story, okay? That's kind of a mastectomy, et cetera, et cetera. That's a whole different thing. So again, you have to have some reasonable expectations because you have to have a certain amount of tissue that stays there to keep the nipple areola complex happy. The other thing is, as you're moving the skin tissue around, the skin has to be a certain amount of thickness too to keep that well perfused and happy. So there is a limit. You can be aggressive, but you have to be safe. And again, like anything else, always best to come in, have a board certified plastic surgeon take a look at you and see really what's going to work for your particular case. Any questions? Give us a shout.